Hi, I'm Dr. Dennis Roberts. I'm an American clinical psychologist here at the Parapsychology Center. I'm a big believer in change. Psychotherapy is about changing our lives, our thoughts, our emotions, our behaviors. So I really focus on what we can change in therapy. My work is grounded in behavioral and cognitive behavioral approaches, and that means we focus on seeing how our thoughts, our emotions, our actions are connected, and how small but intentional changes can lead to real improvement. I draw on acceptance and commitment therapy, which emphasizes learning to live with greater flexibility, purpose, self compassion, even when life is challenging. And above all, I try to create a space in my office here that feels calm, collaborative, practical. We want to work together to help you move to the life that you want to be living. My background is in clinical health psychology, but my general practice is with the full range of things people bring, depression and anxiety. But that means I also have training in things like chronic pain, dealing with significant medical diagnoses, behavioral sleep disorders. A lot of people face difficulties with insomnia and other sleep issues. What is something unique about how you work? Well, before moving full-time into clinical work, I spent a few years teaching university students, and I think that experience somewhat shaped my style. There's a whiteboard here in my office on the other side of this room, and I often find myself standing up and sketching things out, mapping behaviors, emotions, or thought patterns. I think it helps to make the process visible. Well, outside of work, I spend a lot of time with my two big dogs. They keep me grounded and active. I'm also a longtime Chicago Cubs fan, so I follow baseball from afar. And I've really enjoyed learning more about life here in France. It's been an adventure, and it's reminded me what it's like to adapt, to learn, and to grow, which is something I like to think about a lot in therapy too. Seeing people begin to experience change, to live more freely, and to reconnect with what matters most to them. Look, here's the thing. Therapy is hard. Therapy is hard for everyone. And it's a bit unnatural to come into a new office, new face, and to try to open up and to look for ways to change your life. I think we all need a little bit of courage. And so one of the things I try to sell in the first session is a little bit of courage. And then I think it takes some self-compassion. People are very hard on themselves. They give themselves lectures. I've got to get better. I've got to get better. In a first session, I try to encourage us to dial that down. That doesn't get us as far. That doesn't get us as far as we think it might. And then the last thing I try to come up with in a first session, the first time I meet someone, is the idea of hope. You've got to have hope that things are going to get better.